Welcome to the Department of Veterans Affairs video regarding transplant services. You are watching this video because you or someone you know may be considering a solid organ transplant at the VA as a treatment for a medical condition. It is our honor and privilege to be able to serve you, our veteran, and your family members as you consider this very specialized care. The Veterans Health Administration is the largest integrated healthcare system in the United States. Our healthcare centers reach across America, providing care at more than 1,200 facilities, 13 of which offer solid organ or bone marrow transplantation. We pride ourselves in being able to serve the healthcare needs of over 8 million veterans each year. The VA's solid organ transplant program dates back to 1962. Since that time, VHA has continued to build and obtain the necessary specialized medical and surgical teams to provide this very specialized service. Our goal at the VA is to continue to be the benchmark of excellence in healthcare by providing exemplary services that are patient-centered and evidence-based. We honor your service to our country and wish the very best for you and your family. The VA has the responsibility and authority to provide complete care and treatment for veterans with end-stage organ disease in need of deceased or living donor transplant specialty care by providing transplant services for the following solid organs: heart, lung, liver, kidney, pancreas, and small bowel. Transplant care is a specialized service that is provided at certain VA medical centers. Therefore, you may need to travel to a VA medical center that is recognized as a VA transplant center that performs the type of transplant you need. The costs associated with obtaining this specialized medical surgical care are covered by your individual VA benefits plan, including the costs associated with your living donor if you have one. Please contact the benefits coordinator at your local VA medical center to understand your specific benefits, including any copays you may have. Let's walk in the shoes of this veteran. This is where the transplant referral process starts.
Ryan, I have just reviewed your most recent kidney function tests, and unfortunately the results are worse. We have to start dialysis now, and we need to start thinking about the possibility of a kidney transplant as a long-term treatment option.
Is it that bad, doctor?
If he gets a new kidney, will he be cured?
A kidney transplant will give you a functioning kidney, and that'll allow you to stop dialysis, which will improve your quality of life. However, you will have to take anti-rejection drugs for the rest of your life to help prevent your body from rejecting the new kidney.
How do I get a new kidney? What's the process?
We would begin by doing some tests at your home VA medical center to make sure that transplant is the best option for you and to see if there are any other medical or psychosocial problems that would prevent the long-term success of the transplant. We would do some blood tests, x-rays, and maybe even a biopsy. You'll also need to see a social worker, a mental health provider, and a dentist. When the tests and the assessments are complete, we'll send those results to the transplant center. Do you have any questions?
Well, if it's what you think I should do, how do we get started?
Our transplant referral coordinator will arrange all of the tests and help you set up a My Healthy Vet account if you don't already have one, so that you'll be able to communicate with your VA healthcare providers.
A transplant team of physicians, surgeons, physician assistants, nurses, advanced practice registered nurses, transplant coordinators, a social worker, and others will review your medical and surgical history and test results to see if you meet all medical and psychosocial eligibility criteria and to determine whether or not transplantation is the best treatment option for you. The team has 5 days after they have received your test results to determine if you meet the transplant center's medical and psychosocial criteria for further evaluation. If you do meet criteria, the transplant team will schedule a meeting with you and your support person. This evaluation appointment will occur within 30 days of when you were first referred for transplant. There are 2 important reasons for this evaluation. First, to see if there are any other treatment options other than transplantation for your condition. Second, to see if you have any other problems that would prevent a successful long-term outcome after transplantation. You may be wondering if and when you might have to travel to the VA Transplant Center. You may need to travel if 1. You need to undergo special testing and evaluations that are transplant-specific and cannot be done at your local VA medical center. 2. You may need to travel if you are very ill and have to be hospitalized at the VA Transplant Center until a donor organ becomes available. If you live far away from a VA Transplant Center, you may have to relocate as you get closer to the top of the waiting list. If you have to travel, you and your support person and your living donor, if applicable, may be eligible for reimbursement for all transplant-related round-trip travel costs, including those incurred for the pre-transplant evaluation, the transplant surgery, and all post-transplant follow-up appointments. Approved lodging is provided for you, your support person, and a living donor, if applicable, at no expense to you. Please remember to contact the business office at your local VA medical center to discuss your travel benefits. After your in-person appointment with the transplant team, the team will decide if you meet all medical and psychosocial eligibility criteria to be placed on the waiting list.
Hello?
Hi, Ryan. It's Sarah, your transplant coordinator. Hey, I have some good news for you. The transplant team has reviewed your test results and you meet all of our transplant eligibility criteria. So, you'll be placed on the wait list for a kidney transplant today.
Oh, that's great. I'm on the list. I'm on the list. Is there anything I need to do now?
Not right now. The transplant team will be contacting you, but in the meantime, I'll be sending you a formal letter stating that you've been placed on the wait list. As we discussed before, the United Network for Organ Sharing, UNOS, maintains the national waiting list for patients needing any type of solid organ transplant.
How long will I be on the waiting list?
We're not sure how long you'll have to wait for a donor organ. You may be waiting weeks to months, or even years.
Years?
Unfortunately, the number of people that need organs far exceeds the number of available organs. But you will be in good hands while you're on the waiting list. Our transplant team will stay in contact with you through phone calls or secure messaging through My Healthy Vet. While you're on the waiting list, you'll need to come back to the transplant center for checkups and have tests done so that we can monitor your condition.
Do I need to come back to the transplant center for all the tests then?
Some of these tests may be able to be done at your local VA medical center.
Good.
When a donor organ becomes available, the VA Transplant Center will call you. You and your support person will immediately travel to the VA Transplant Center for the transplant surgery.
How are we doing here?
Okay.
Everybody feeling all right? Listen, in just a few hours, you're going to be feeling a whole lot better.
You will be admitted once you arrive at the transplant center and undergo pre-operative tests. Then you will go to a holding area where an IV and other lines will be inserted. The operating room staff will tell you about how long the operation will last. After the operation, the transplant surgeon will talk to your family members.
I have a list of medications that I want to just take a second and go over with you. The immunosuppressant is something that you're going to need to take.
Before you are discharged from the hospital, your transplant team will provide verbal and written instructions regarding all of your medications. You'll be given immunosuppressants and antimicrobial agents. The immunosuppressive agents are anti-rejection medications. They're given to help prevent your body from rejecting the transplanted organ. It is important for you to understand that you will remain on one or more of these medications for the rest of your life. The dose of each medication may change from time to time based on your lab work, biopsy results, time from transplant, and any side effects you may experience. The antimicrobial agents are medications such as antibiotics. They are given for two reasons. First, they are given immediately after transplantation to prevent infection when your doses of anti-rejection medications are highest. Second, they are given any time after transplantation to treat any infection you may develop. Finally, your transplant team may also prescribe other medications, such as those to lower your blood pressure or control your blood sugar. You and your support person will have to stay near the transplant center for a while after you are discharged from the hospital. The VA transplant centers have different types of lodging available for transplant recipients and their support persons. During this time, you'll return to the transplant clinic for lab tests and checkups. Once you receive your transplant, you will be followed by the transplant center team for the rest of your life. This follow-up may include blood work, x-rays, organ-specific tests, and in some cases, biopsies to check for organ rejection. You and your support person maintain your transplant travel benefits. In certain circumstances, you may have your follow-up tests done at your local VA medical center, and the transplant team will follow up with you via telehealth. Your home VA medical center will continue to be involved in your care, in collaboration with your VA transplant center. As a transplant recipient, it is important for you to follow all of your transplant team's instructions and maintain a healthy lifestyle. Your transplant team will give you specific instructions regarding a healthy diet, exercise, routine cancer screening, and other important guidelines to follow. As a transplant recipient, you will have to take medications to keep your new organ healthy. Make sure you know the names of your new medications, the purpose, and dose of each, and the time you're supposed to take them. It is important for you to promptly notify your transplant team of any side effects you may have. Your transplant team may change your medications and dosages often, particularly during the first post-transplant year. The transplant team will work with you to find the right balance of medications to keep you and your new organ healthy. Some patients who need an organ transplant have a living donor. A living donor is a healthy individual from whom one organ or a portion of an organ is removed surgically for transplantation. Living donors may be family members, friends, strangers, veterans, or non-veterans. The potential living donor must undergo a comprehensive physical and psychological evaluation to ensure that donation is safe for them. There is no cost to the veteran or the living donor for this evaluation through the VA. After donating an organ, the living donor is medically monitored for 2 years by the VA transplant center that recovered the organ. VA travel benefits that apply to the veteran also apply to the living donor and the living donor support person. A transplant can add many years and greatly improve the quality of your life. The VA takes pride in caring for your medical and surgical needs. You have served our country well. Now it is our time to take care of you.